public health and medical professionals. Let me start by explaining how a virtual town hall works. Right now, residents across Corpus Christi and Nueces County are answering their phones and connecting to this important discussion. We also have people joining us online through the City of Corpus Christi Facebook and YouTube pages. We'll hear from our speakers shortly. After that, it will be your turn to have a chance to ask your questions about COVID-19 health and medical professionals. You can get in line. Let me start by explaining how a virtual town hall by pressing *3. Right now, residents across Corpus Christi and Nueces County be put through to are answering their phones who will take down your question this important discussion. We also have people joining us online. You can also ask questions. On Facebook and YouTube pages, you'll see a link where you can go to type in your question and name. We will also be asking you questions in the form of quick polls. I will read out a question along with some multiple choice responses, and then you'll be able to use your keypad to select the answer that best reflects you. Here are a few things to keep in mind when you press *3 to ask your question. After pressing *3, you'll be routed to an operator who will ask you to provide your first name. Please try to keep your question as brief as possible. We want to get to as many questions as we can. Again, my name is Vieri Beretti, and I'm very excited to be your moderator for this virtual Ask the Experts town hall on COVID-19 vaccines. At this time, I'd like to introduce our panelists who have taken time out of their very busy schedules to join us for this important conversation. From Corpus Christi, Nueces County Public Health District, we have Director Annette Rodriguez, Assistant Director Luis Wilmot, Public Health Emergency Preparedness Manager Dr. Moriam Ajalade, and Epidemiologist and Public Health Administrator Denzel Otokunran. I'm also pleased to introduce Dr. Srikanth Ramachandruni, Local Health Authority for Nueces County and Infectious Disease Specialist, Dr. Kim Onyu Frank, Clinical Director and Alternate Local Health Authority for Nueces County, Dr. Osbert Blow, President and Chief Medical Officer for Christus Spohn Health System, Dr. Mary Pearson, Executive Vice President and Chief Operation Officer for Driscoll Health System, Dr. Jaime Fergie, Director of Infectious Disease at Driscoll Children's Hospital, and Dr. Juan Ramirez, Medical Director of Emergency Services at Corpus Christi Medical Center. Thank you all for bringing your expertise to this discussion. To begin the discussion, Director Rodriguez, can you give us an update on COVID-19 in Corpus Christi and Nueces County?
Yes, absolutely. And thank you all to all the panelists and to everybody that's called in. Good evening. I'm Annette Rodriguez. I am the Director of the Corpus Christi Nueces County Public Health District. And I would like to start off by, again, thanking everybody for joining us this evening and being part of the discussion on COVID-19. Again, the purpose of the town hall meeting is to ensure that our community has all the information they need on vaccines and any other COVID-related questions you may have, whether that's on transmissibility or isolation protocols or even treatments. So please ask your questions. We will answer these questions the best that we know how. And we are hopeful that when you're trying to decide whether to get vaccinated or not, that you will be able to make a decision after us answering those questions. We hope that together we can reach everyone in our community by answering your questions and then having you share what you've learned with your friends, your family, and anyone else in the community that's asking. So I wanted to say that currently we have about 60% of our eligible population that is fully vaccinated. Those are people that are 12 years of age and older. And we have vaccinated a total of 184,000 people here in Nueces County. These numbers are quite impressive, but we know that we need more people vaccinated to put an end to this pandemic. So again, we have an hour and a half. Feel free to ask as many questions as you'd like until you are completely satisfied and comfortable in making a decision on whether to get vaccinated. Thank you again, and let's get started.
Thank you very much, Annette. Just a reminder, please press *3 on your phone to get to a line to ask your question. You will also have the opportunity to leave a voicemail for our experts if you stay on the phone after the town hall ends. For those of you just joining us, my name is Vieri Beretti, and I'm your host for this evening's Ask the Expert Town Hall on COVID-19 vaccines. A virtual town hall is just like a radio talk show, except instead of you tuning into the radio, you answered your phone when we called. Tonight, we're talking about COVID-19 vaccines. If you have a question for our speakers, just press *3 on your phone now to get into line to ask your questions. And I see we already have people who have gone into line and spoken to our operator, so we'll go to our very first question of the evening. Elza, who has asked this question online, why is Nueces County death rate consistently so high compared to the number of cases? And Dr. Ojalade, would you like to take that question?
Yes, thank you. So the death rate has a tendency to lag behind the actual time that that people test positive. So from the period that they from the time they first become infected, and then they become severe enough to be hospitalized or get into the ICU, that could be a few days to weeks. And so that is one of the main reasons that the death rate can remain high, even though cases are starting to decline.
Thank you so much for that, Doctor. Our next question is actually a live question from Eli. Eli, you're live. Please go ahead and ask your question. Eli, are you there? Okay. I'll ask the question.
The Moderna shot, but as far as the health department goes, we are still waiting for CDC guidance. So as soon as we get guidance from the CDC, we're still waiting on the final word from Dr. Walensky with the director. So as soon as we get guidance from the CDC and DSHS, then we will put the press release out and all of our clinics will be able to provide the Moderna booster.
Thank you for that, Dr. Anufrat. As I mentioned, in addition to taking your questions, we'd like to ask you some questions in the form of quick polls, which I would like to do now, at least for our first poll. I'm going to ask a question and read out 5 answers. Please choose the answer that best reflects you by pressing the number on your phone keypad. Online listeners, look for the link in your YouTube or Facebook and click the link to go to the page where you can enter your question or respond to a poll. Please listen to all of the answers before you make your selection. Our first question is to help us understand who is on the call on the town hall tonight. We'd like to know what age range you are in. Press 1 for 18 to 25. Press 2 for 26 to 35. Press 3 for 36 to 49. Press 4 for 50 to 65. And press 5 if you are over 65. Again, that question is to help us understand who is in the town hall tonight. We'd like to know what age range you are in. Press 1 for 18 to 25, 2 for 26 to 35, 3 for 36 to 49, 4 for 50 to 65, and 5 for 65 and over. And thank you for participating in the poll. And while we have participants answering the poll, let's move to our next live caller. And our next live caller is Bill. Bill, you're live. Go ahead with your question. Bill, maybe you need to unmute yourself. All right, I'll ask Bill's question for him. Had first 2 Moderna shots, 8 weeks since the second shot, would like to know if it's safe to get third dose and how soon. Dr. Fergie, would you like to take that first?
Yes, absolutely. I think it is safe right now. You know, we want to be sure that person have had at least the 4 weeks, but anytime after the 4 weeks, it is safe to take your second dose. So you never have to restart a vaccine series. So just go ahead with your second dose of your Moderna vaccine.
Thank you, Doctor. And I think Dr. Onufrak, would you like to address that as well?
Yes. So if you've had your first 2 doses already of Moderna, you can get your third dose only if you are immunocompromised. So you have to meet the parameters for immunocompromised condition. So mainly if you are currently undergoing chemotherapy, if you've had a history of organ transplant, if you're taking any immunosuppressants, you are safe to get that third dose if you're immunocompromised at least 28 days after your second dose. Now, if you're wanting a booster, those that are 65 and up, those that are high risk, can get your booster dose at least 6 months after the second dose. So there's a difference between a third dose and a booster dose. So it's safe. You don't, like Dr. Fergie says, you don't have to restart the series. If you haven't had your second dose, you just get your second dose as long as it's after 28 days after your first dose. And then your third dose is 28 days if you're immunocompromised. And then your booster is 6 months after your second dose.
Thank you so much for clarifying that, Doctor. I appreciate it. I would like to actually go to our second poll question. If you don't mind, we have a few poll questions that we want to get asked. So our second poll question is, what is your vaccination status? Press 1 for I have both vaccinations. Press 2 for I have 1 vaccination. Press 3 for I'm planning to get vaccinated. Press 4 for I am not planning to get vaccinated. Press 5 for I prefer not to say. Again, that question, that second poll question is, what is your vaccination status? Press 1 for I have both vaccinations. Press 2 for I have 1 vaccination. Press 3 for I am planning to get vaccinated. Press 4 for I am not planning to get vaccinated, and press 5 for I prefer not to say. And thank you for participating in the poll. And while you're participating, we'll go to our next question. And our next question is from Linda. And Linda asks, I live at a seniors community apartment, and the fire department came to give us our vaccine doses 1 and 2. Will they come to give us our booster? And if so, when? Dr. Fergie, would you like to address that question?
Well, thank you. I believe that will be probably better answered by the colleagues from the health department.
Annette, would you like to take that? Oh, Annette, I think you're on mute.
Oh, sorry about that. So the answer is yes, we can go and give you your booster at your home. You would call the same number that you were calling before for the SOS, or you're always welcome to call the health department at 361-826-7200, option 2, and we can help you to get that booster as soon as that Moderna booster is approved by the Department of State Health Services, and we have the green light to start giving them.
Thank you so much for that. Let's move on to our next question. Our next question comes from Rhonda. And Rhonda, you are live. Are you able to unmute yourself and ask your question? All right. I'll ask Rhonda's question for her. Are there death numbers about the people who have received vaccine? I think what she means is, what are the numbers for the people who have received vaccine but have unfortunately caught the disease and died? Dr. Rodriguez, would you like to take that? Or Dr. Wilmot, would you like to take that? Or Luis Wilmot, sorry, apologize.
Absolutely. So the Public Health District does track vaccine breakthrough cases, and we are reporting those to our area at least on a weekly basis, if not daily. So I believe our number of deaths for vaccine breakthrough cases, and correct me if I'm wrong, Moriam, but I believe it was about 56 of those fully vaccinated.
Annette, did you have something you wanted to add?
I actually was going to ask Dr. Elogia if she would answer that for us.
Okay. Doctor, would you like to answer that one, or?
Yes, absolutely. Basically, the patients who have been vaccinated and unfortunately have been deceased or have been dying, pretty much are patients who belong to the older population, or patients who have been unfortunately having underlying diseases and comorbidities, like immunosuppressed status or patients with high cardiovascular disease. And they, despite the vaccination, they unfortunately, the immune system is a little bit weaker than everybody else. And that creates an enormous impact in the outcome, even though they are vaccinated. So that's one of the reasons. However, the fact that the most of the elderly population and all the people who have been immunosuppressed have been immunized, having the vaccine that give more protection than not having the vaccine. So I believe the vaccine is helping tremendously to decrease the mortality in this group. Absolutely, if this group has not been vaccinated, the mortality will be significantly higher.
Thank you, Doctor. And Dr. Blow, did you want to add to that comment?
Yeah, I did. Thank you. And I agree with everything that's been said. I did want to stress something, though. You know, the numbers have been small, and I know that I've been asked that question a lot. How many people have died who were vaccinated? I think one way to look at this is we have just now gone through our second pandemic, and 90+% of those hospitalized were unvaccinated. So that means the majority of the folks who were vaccinated had a mild version of disease and were able to take care of themselves at home. The burden on the healthcare system, which has created a significant collateral damage to and delay in healthcare to those with chronic disease and seeking other forms of care, have been primarily due to the fact that this second pandemic was in the unvaccinated. Also, and I think that Dr. Ramirez's point, which very well stated, that the elderly, well, those are the ones patients that we targeted first, elderly, immunocompromised. And so it really did not come as any surprise that we saw fewer of those in hospital. And I do agree, and it is consistent with what we saw in our health system, especially those with end-stage renal disease and further out from their second dose of vaccine, which were accounting for the higher mortality and also the extremes of age. But clearly in the unvaccinated, it was the young population who sadly and tragically made up the majority of our deaths.
Thank you, Doctor. Thank you for that. Our next question comes to us from Ruby. And Ruby asks, how soon can I get a Moderna booster? I'm 75 and diabetic. My second shot was March 30th. So again, that's Ruby, and her question was, how soon can I get a Moderna booster? I am 75 and diabetic. My second shot was March 30th. Dr. Onufrak, would you like to take that?
Yes. So the CDC just recently approved Moderna. So we are still waiting on the CDC guidelines, guidance and DSHS guidance. So as soon as that comes out, maybe tomorrow or sometime this weekend or next week, then we will let the public know and we will start giving out the Moderna booster at all of our vaccination clinics.
Thank you, Doctor. Our next question comes from Jesse. And Jesse asks, is there any reason for me to get the vaccine if I have tested positive for antibodies? Dr. Peterson, would you like to take that first?
Sure. And then I think my colleague, Dr. Fergie, can add on. But we do have a lot of information that even though you've had COVID and you may have some antibodies, that actually getting the vaccine provides superior protection from getting reinfected or another infection. And this has been pretty clear in a lot of studies that the vaccine is actually more protective against some of these variants, like the Delta variant we've just experienced in Corpus Christi area, than natural immunity. And I'll let Dr. Fergie add to the problem with antibody tests.
Thank you, Dr. Peterson. Indeed. And I think that, first of all, there are so many different antibody tests out there. And one of the problems we have is that nobody really knows the value, the number at which you are considered protected from the illness. So, I mean, it's good if you have some antibodies that can be detected. That's for sure is good. But we don't really know how high that number has to be for you to be protected from the infection. We do know, however, that the vaccines are going to help you, are going to boost your immunity, and you're going to be better protected and protected for a longer time after you have had, even if you have already some antibodies.
Thank you, Doctor. I'll move on to our next poll question. Have you ever had a friend or family member become hospitalized due to COVID-19? So press 1 on your phone keypad for yes, and press 2 on your phone keypad for no. And again, that question is, have you ever had a friend or family member become hospitalized due to COVID-19? Press 1 for yes, and press 2 for no. And since we're doing polls, I'm just going to skip right into our next poll question, our fourth one. Have you ever had a friend or family member pass away from COVID-19? Press 1 for yes, press 2 for no. And the question again is, have you ever had a friend or family member pass away from COVID-19? Press 1 for yes, and press 2 for no. Thank you for participating. And while participants answer those important poll questions, we'll move on to our next participant online. Our next participant is Nora, and Nora asks, what is considered high risk to qualify for the booster shot? Denzel, would you like to take that question?
Yeah, I can definitely take that question. So before I start, I do want to say that currently the boosters are available for those who have Pfizer. It's the Pfizer vaccine. So for those that meet the qualifications for high risk would be those 65 years or older, those 18 and plus that work in long-term care facilities or work in facilities where they're working around individuals who are COVID positive. And so those who are 18 and older that have underlying conditions that if they were to get COVID, it can lead to possibly to hospitalization or more severe condition.
Thank you for explaining that, Denzel. Our next question comes to us from Roberta, and Roberta has asked me to read this question for her. Her question is, when will the children's vaccines be approved? So Roberta would like to know when vaccine for children will be approved. Annette, I'll let you take that one first, and then we'll go to Dr. Fergie.
Thank you for that question. So we're hearing that next week, October 26th, around that time period, this will go for review to the FDA to see if they approve the pediatric vaccines for those ages 5 to 11. If that's approved, then it goes through the same process where it goes to CDC for the final approval, and then the Department of State Health Services will approve it. So we're hoping by early November, those pediatric doses will get the approval, and then we'll be able to open that up to our community. Thank you.
Thank you, Annette. Dr. Fergie?
Well, indeed, that's want to say about the same in terms of the time frame. I think that it's exciting news, I think, for the community, because we need the children also to be vaccinated. So we are delighted to know that this is moving forward. Here in Nueces County, in Corpus Christi, at Driscoll Children's Hospital, we have been part of this effort. We have been part of this national and international effort testing the vaccine in children. We have participated in the 5 to 11. We're also doing the 6 to 5 years of age trial. So I'm very optimistic that this will be approved, and then our children here will have the opportunity to be protected against COVID-19 and protect all the family.
Thank you, Doctor. And Dr. Peterson, did you want to add to that as well?
Right. I just wanted to bring up that Driscoll Children's Hospital is planning on having vaccination clinics. We're tentatively planning the first one, assuming we get the vaccine and all the approvals, on November the 4th, and there'll probably be after school clinics at the Driscoll Auditorium. So we're really looking forward to that, and, getting this out to our kids. Although the disease, is not normally as severe in children as it has been in adults, unfortunately, we have had, a number of children, especially with this Delta variant, hospitalized in the ICU, on ventilators, on heart-lung machines, and a few who have passed away. And so we're very happy that we're going to get this vaccine. And we're also very hopeful, and Dr. Fergie can talk about this, but we've also participated in the trials from 6 months to 5 years of age. And we're hopeful that, hopefully I'm getting the timeline right, that by the end of the year that we may have vaccines in even younger age groups. So I would encourage everybody to stay tuned for those great new developments.
Thank you so much, Doctor. Our next question comes to us from Elvira. And Elvira asks, I am due for my flu shot. Can I have my flu shot and then my COVID booster at the same time? Again, the question is, I am due for my flu shot. Can I have my flu shot and then my COVID booster at the same time? Dr. Onufrak, would you like to take that question?
Yes, you can get both your COVID and your flu shot at the same time. So if your pharmacy, your doctor's office, if they offer both the flu and your booster shot, or if you haven't received a COVID vaccination, you can get both your vaccinations at the same time.
Excellent. Thank you so much. Our next question comes to us from Tanya. And Tanya asks, what are the side effects young boys receive from the vaccine? What are the side effects young boys receive from the vaccine? Dr. Fergie, would you like to take that question?
Yes, it's certainly. And I think that what we have seen is very similar in terms of side effects from what has been seen in the general population in terms of the swelling, the pain associated with injection, some fever. And perhaps the question also have to do a little bit with the younger adult, perhaps with adolescent and young adults, in which the issue of the heart inflammation have been seen in a few of the recipients of these vaccines. We have seen at Driscoll a very rare issue that happens, but it does occurs, usually young males, and it fortunately resolved very quickly without any major problems. But in terms, for example, of the major studies in the young kids, in the 5 to 11, the side effect, what we call the reactogenicity, what we have seen is pretty standard, pretty common for vaccines in terms of little fever, swelling, malaise, and loss of appetite, and it resolved in a few days.
Thank you, Doctor. Our next question comes to us from Susan, and Susan asks, as
Barry, I think you're muted.
oh, yes, I was. So I apologize for that. So the question is, from Susan, as a metastatic breast cancer patient, is getting a combination vaccine dose better? Denzel, would you like to take that?
Yes, of course. So per CDC guidance, as of currently, there isn't an evidence stating that mixing vaccines will give you a better chance of immunity, but it is highly recommended that whenever you're getting your dose series, so either Moderna or Pfizer, that you complete the series. So if you started off with Moderna for your first dose, get it for your second dose. Pfizer for your first dose, get it for your second dose. Now, there are situations now, if you were unable to complete the series with the original dose, with the original company, they do recommend that you could finish it off with the other. But as it stands right now, it's recommended that you complete it with the company you start off with. So Moderna, finish off with Moderna, Pfizer, finish off with Pfizer, and Johnson & Johnson's your one dose, one and done.
Thank you, Denzel. Our next question comes from Sherman online, and Sherman asks, can a private employer mandate me to be vaccinated? Can a private employer mandate me to be vaccinated? Annette, would you like to try that one? Nope. Yep.
Yes,
Yep.
I believe that if it's a private employer and if the FDA has approved it, it's not an EUA, it's not an emergency use authorized vaccine, but it's an approved vaccine, that they are allowed to mandate that you get a vaccine as part of your employment. So yes.
Thank you, Annette. Dr. Peterson, would you like to add to that?
I'll try to add to that. It's a little complicated right now because we're getting mixed messages from the state and federal government. The governor has put out a anti-vaccine mandate that includes private employers. The legislature did not pass that. The federal government is looking to create rules this month that all private employers with 100 employees or more and all healthcare workers be mandated to get vaccine. So, that's the best I can give. My advice would be everybody who can get vaccinated gets vaccinated regardless of whether there's a mandate or not, because that'll protect you the best and protect your loved ones and all the people around you.
Thank you, Doctor. Good advice. Our next question comes from Jeannie. Is it true that it's okay to mix vaccines? For example, if you had a Moderna vaccine, can you have a Pfizer booster? Dr. Peterson.
I may defer to Dr. Fergie to begin with on this one because there was some recent news that just came out today.
Okay, Dr. Fergie.
Yeah, I would just say that there very recent news today from the Advisory Committee on Immunization Practices, in which they basically say mix and match, it's okay. So I think that is a reasonable approach to go ahead and if you don't have the same one, you can go with another one. And they are discussing small differences. Perhaps if you have a risk factor for blood clots, maybe you go for an mRNA vaccine. Or if you are a young man and have concerns about heart inflammation, maybe you go with J&J. But basically, there's little information, little solid information to go to make a decision. I think we know a lot more about maintaining the same brand. There's more studies, more publications in people in which have done the booster with the same vaccine, be it Johnson & Johnson, be it Moderna, or be it Pfizer. But indeed, today, CDC, ACIP gave an option to mix and match.
Thank you, Dr. Fergie. Our next question comes to us from, I hope I haven't pronounced this name incorrectly. I apologize if I do. It's Senovio. Senovio asks, I want to know if the county is considering the possibility of natural immunity for those that have had and survived COVID-19. I want to know if the county is considering the possibility of natural immunity for those that have had and survived COVID-19. Well, Dr. Peterson, would you like to take that?
Sure. I mean, I think this relates to a similar question we had earlier, and we know that, while natural immunity can be good, it's probably not as good as also getting the vaccine, especially with the variants that have come through. And we've got a lot of examples of that. We had, the really sad story in a pretty big city in Brazil that actually 75% of the population was infected early on, and they thought, that they were okay, and then they had a new variant that ripped through Brazil, and many people got sick again, and many more died. And so we have seen that the vaccination can help boost immunity and prevent those second infections. And I don't know if anyone else wants to add to that, but we're still learning, obviously, and that's why we have the booster shots now. That was shown in Israel that some of the antibody levels and immunity was waning, and it felt like boosters would help with that. And I think that's part of the, reasons why, the federal government has authorized the boosters. So your natural immunity wanes as well. I mean, this COVID virus, we have 4 existing coronaviruses that have been circulating for many years that cause like a common cold. And we know that we get those over and over again. And so anything that we can do to boost our immunity, like with immunization, it looks like, even if you get it naturally, you're not going to be good forever with that, it appears.
Thank you, Doctor. Annette, and then we'll go to Dr. Blow.
Yes, I just wanted to add that in our percentages where we're saying 60% of those that are 12 years and older that are fully vaccinated, we're only talking about individuals actually vaccinated. We're not including natural immunity. So I just wanted to make sure that you were clear on that. And 77% of people 65 years and older, it's those that are vaccinated. We haven't included the number of people that have gotten COVID-19 into those numbers.
Thanks for the clarity, Annette. Dr. Blow?
Yes, I just wanted to reiterate Dr. Peterson's point, well stated. Immune senescence, right? As we get older, it's a sad thing to consider, but we do, thankfully. And nowadays, after going through 2 pandemics, it's something is not a given. So, but the immune system, as any other system in our body, does age, and there is senescence. So while we may have had COVID, that doesn't guarantee that your immunity is as effective as being vaccinated. And then, as Dr. Fergie pointed out, the antibody levels, while it sounds great to have antibodies circulating, we don't have a clear understanding as to the type and quantity, if you will, of antibodies that need to be circulating in order to combat the next challenge to your body. So what we do know is that people who are not vaccinated, who have had COVID, have also succumbed to second and third challenges of COVID. So again, no guarantees that having had COVID will give you the natural immunity you need to combat the next variant.
Thank you, Doctor. And I'll just remind participants that if you have an important question that you'd like to ask our experts, please press *3 on your phone now to get in line to be able to ask your question. Our next question comes to us from Joshua. And Joshua asks, what can people say to family members who are afraid to get vaccinated? Dr. Ramirez, would you like to take that?
Absolutely. This is a very good question. And I will change the question this way, or I'm going to do this statement. You should tell the family member who had not been vaccinated to be afraid for many reasons. Number one, even though you are young and you will unlikely be very sick, you might be sick. And it's up to you. You want to take the risk. But the major issue is being young, and if you have the infection and you obtain COVID-19, you might not feel it. And this is where the problem starts, because you don't believe you have it because you don't have symptoms, or you have a little cold type symptoms that you might be thinking is a simple cold. Then you go home and you stay with your mother, you stay with your grandmother, or your sick aunt, and you bring this virus home thinking that you don't have any virus. And then your mom, your sick dad, your sick aunt, your grandmother have the potential to die because of you. So I think if you are not vaccinated, you should be very afraid, because it's a potential risk, and we need to make sure that you understand that fact. And I will tell everybody to encourage every single family member who has not been vaccinated to please do so. The FDA and the CDC are very solid agencies in the United States, the best in the world. And not only here, but in several countries, they have their own agencies. And it has been proven that the vaccine saves lives. And it's very, very less risk to be vaccinated than not being vaccinated. So don't be afraid of the vaccine. Please be afraid not being vaccinated.
Thank you, Dr. Ramirez, and thank you for that important message. Dr. Blow, would you like to add to that?
Yes, sorry. You know, I think it's a very good question, and I have thought about it a lot. Actually, I thought about it when Annette asked me to be the first person to take the vaccine, because I have a bad reaction to the flu vaccine. And literally, I had to weigh the risk benefit of getting the vaccine. So on a personal note, I've had 3, the 2 and a booster of Pfizer. But, and I did think about it the way Dr. Ramirez thought about it, but then I encountered several other people who have genuine phobias to needles and genuine phobias to vaccine and genuine phobias. And I think what we really should be doing is trying to understand the source of the anxiety and fear, so that we can tailor our response to address the concern, the specific concern that I'm finding is very different person to person in terms of whether or not they should be vaccinated. So a great question, and identify the fear and help them do it. And definitely.
Line unmuted.
I'm not sure what's, there we go. I think that solved the problem.
That was just a special effect to hit home the point, get vaccinated.
And very effectively. Thank you. Luis, would you like to add to that?
Yes, thanks, Docs, for those good responses. Also, you know, you're asking what should you say to family members? Well, the first thing you should do is get vaccinated yourself, right? So that's the best way to show them, hey, I'm doing it. I'm perfectly fine. I did well. I had no issues. It's very safe. It's effective. So, you know, your actions will probably speak louder than words. Remind them also that we're not seeing people dying from COVID vaccinations. We are seeing people dying from COVID disease. And that is clearly evident in the statistics we roll out for our city council and our county court commissioners. We give this data out and says there's perfect graphics, especially on the city websites, is showing folks that are vaccinated, unvaccinated, who's positive, who's not, who's being hospitalized. Those statistics paint a very vivid picture to say the vaccine is effective and it's not killing our people. COVID-19 is killing our people. So.
Thank you, Luis. And thank you all for those excellent answers to that very important question. The next question is from Martina. And Martina asks, do you need an appointment to get vaccinated? Very straightforward question. Do you need an appointment to get vaccinated? And Denzel, I'll let you take that one.
No, you do not need an appointment to get vaccinated. You can go to some of our permanent sites like the Greenwood Senior Center or La Palmera Mall where walk-ins are welcome.
Thank you, Denzel. We'll move on to our next question from Charlene. And Charlene asks, my husband has Lyme disease. Is it safe for him to get vaccinated? So Charlene's husband has Lyme disease, and she'd like to know if it's safe for him to get vaccinated. Dr. Onufrak, would you like to take that?
There are the only contraindications to getting the COVID vaccine is if you have a severe allergic reaction to any of the ingredients that are in the vaccine itself. And then if you do happen to get an allergic reaction with your first dose, then you can always talk to your doctor about maybe being referred to an allergist to find out what your reaction was in the vaccine. But there's currently no contraindications unless you have a severe allergic reaction to anything that's in the vaccine.
Thank you, Dr. Onufrak. Dr. Fergie, would you like to also add to that?
Yeah, absolutely in agreement. But I want to say, I think many of us get similar questions that may not just be Lyme disease, but it may be lupus, maybe immunosuppression, cancer, a variety of medication people are taking. So that same question applies in multiple variety of those. And in general, when people ask me something about that, it turns out that the person who is asking me that question, if it is safe under this condition, actually that person have a high risk factor that makes it even more important for she or he to go ahead and get the vaccine. So it could be Lyme disease, could be anything else, but in general, I think that Dr. Onufrak already mentioned what is the real only contraindication to this, as just if I had a severe allergic reaction to prior dose. So every time you think about it, just realize that the safest thing to do for you and your family is to take advantage of this very safe and very effective vaccine that we have right now.
Thank you, Doctor. I'm going to actually skip to our last poll question of the night. So this is our last poll question. And our last poll question is, do you plan on vaccinating your children with the COVID-19 vaccine? Press 1 for yes and press 2 for no. Again, the question is, do you plan on vaccinating your children with the COVID-19 vaccine? Press 1 for yes and press 2 for no. And I'll just remind participants that if you have a question that you'd like to ask the experts who are on the panel tonight, please press *3 on your phone now. You'll get into queue. You'll talk to an operator. We'll take your question, and we'll get the panelists to answer it for you. Our next question is coming from Veronica, and Veronica asks or says, the vaccine doesn't seem to be working the way they say. Maine and Vermont seem to be getting hit with COVID again, and they have mostly been double vaccinated. Dr. Jalade, would you like to take that one?
Yes. So that is a great question. It brings the main goal of vaccination is to prevent severe disease and or fatality as a result of the COVID infection. And so the hope is to prevent the infection in the first place. But the main goal, and for the trials with Pfizer, Moderna, Johnson and Johnson, is to prevent severe illness and prevent having to go to the hospital and pass away. So the CDC does say that vaccine breakthrough cases are expected. What we are shooting for is that they are not severe enough to be hospitalized or pass away. And so to add to that, based on our statistics of people that are getting reinfected, we are seeing a lot more reinfections in people that have not been vaccinated. Out of the fully vaccinated individuals that have been identified, we have about 33 that had reinfections. But out of those that were reinfected but did not get a vaccine, about 241 we are finding that got those reinfections. So basically, we are seeing about 8 to 20 times reinfections in those people that are not vaccinated as opposed to fully vaccinated. So So it's definitely best to get the vaccine, as it does protect you from severe illness and or fatality.
Thank you, Dr. Angelade. Dr. Pearson, would you like to add to that?
Sure. It was a great answer from Dr. Angelade. I just think, people have to understand that the vaccines are not perfect. So they're not at 100%. And when, the vaccines were made and COVID first came out in the original studies, they prevented like 90% of disease. And unfortunately, as we get more variants that, in the case of the Delta variant is more infectious and may even cause worse disease, we're seeing that the effectiveness of the vaccine is a little bit lower than that, but it's still great. It's still like, in the 80s. And so what does that mean? Well, that means that, you're going to have, if it's 84%, you've been vaccinated, that means 16% could get sick. But of those 16%, you have much, much fewer, to Dr. Argelade's point, that are going to require hospitalization or would result in death, what we would call, the vaccine breakthroughs. And so we're seeing this, what she points out in Maine. And if we take the states that have high vaccination rates, or even the counties in Texas with higher vaccination rates than what we have, you see that the hospitalization rates are lower, even though they may be getting hit with Delta variant and have an increase in their caseload. It's not overwhelming the hospital systems and resulting in more needless deaths.
Thank you for that, Doctor. Our next question comes to us from Margaret, and Margaret asks, what are the new protocols when you are exposed with no symptoms? What are the new protocols when you are exposed with no symptoms? Dr. Anya Frank, would you like to take that?
So if you are unvaccinated and you've been exposed to a COVID positive person, you should always quarantine. So you need to quarantine for at least 10 days. That's per CDC guidelines. So that's the protocol. Before we were saying 14 days. So the current guidelines is if you're unvaccinated and you've been exposed to somebody, then even if you do not have any symptoms, you need to quarantine for 10 days. Now, if you're asymptomatic and you need to go back to work or go back to school, then you can test. And if you test at day 5, 6, or 7, then you can get out of, and it's negative, then you can get out of quarantine on day 8. But really, you should quarantine for 10 days. And if you're if you're not vaccinated, the guideline, the recommendation would be to get vaccinated.
Thank you, Dr. Onufrak. Thank you. Our next question is from Yvonne. And Yvonne's question is, I believe we contracted COVID in Italy in 2019. We got both shots by February. If we have natural immunity and the vaccines, do we need to get the booster shot? So Yvonne thinks she contracted COVID in Italy in 2019. She got both shots by February. So she wants to know if she has natural immunity and the vaccines, does she need to get a booster shot? Annette, would you like to address that?
That's a great question. And the answer would be yes. And the reason is because even though you got natural immunity back in 2019, we do know that even natural immunity has waning. And so we've also seen that with the two vaccines, because I know your thought process is a great one, that you've gotten the natural immunity and now you've gotten two vaccines. So that is a boost. And it is, but the time period in between, it's still been a while since you've gotten your two vaccines. So yes, the booster would be recommended.
Thank you, Annette. Our next question comes to us from Minnie. And Minnie asks, will our current vaccines protect us against the Alpha variant? Will our current vaccines protect us against the Alpha variant? So I think Minnie means the original variant of COVID-19. And Dr. Fergie, would you like to take that?
Yes, thank you for the question. And yes, this is a regional one, and that's the one in which the vaccines are based mostly. So absolutely, yes. And I'll take the opportunity to say that there have been many tests done with different variants and the vaccines. And, the good news is that even, when we had the concerns about South African strains and we had the concerns about the Brazil strain, they came by. And then, the studies were done to test how good were the vaccines, and they work. Sometimes there was some decrease in the protection, but they still work. So I mean, we have been very fortunate that despite the variants, despite the Delta variants and all the variants we have seen, the vaccines still are safe and highly effective. There may be a slight decrease, but still they're extremely effective, and it's a great thing that we can offer this to the whole country.
Thank you, Doctor. Our next question comes to us from John, and John says he has researched outside of the U.S. He'd like to know if research outside of the U.S. has been considered, or are you going only by what the CDC puts out? With the recovery rate of 90% for the general public, why are we pushing a vaccine with no knowledge of its long-term effects on people? I'll repeat the question. Has research outside of the US been considered, or are you only going by what the CDC puts out? With a recovery rate of 90% for the general public, why are we pushing a vaccination with no knowledge of its long-term effects on people? Dr. Fergie?
Well, I want to say, first of all, that we look at research worldwide. We look at publications from the United Kingdom, from Western Europe, from Eastern Europe, from Russia, from China, from Israel, from multiple sites around the world. And the CDC does the same. And we look at the WHO, we will look at the Pan American Health Organization. So we look at multitude of sources when we come up with our conclusions, our recommendations. Second, I would tell you, I think that is more than 90% of the people who recover from this is much closer to 99%, otherwise we'll be in a bad situation if 10% of the people would not recover. So it's probably, it's about 99% in general. Now you're a high-risk group, then that's different. Then you bring up the issue of the long term, and I hear this very frequently, very, very frequently. And I want to tell you that all the vaccines that we have in history, the vaccines side effects, the reactogenicity, the problems, they do all occur shortly after receiving the vaccine. We haven't seen issues in which you receive a vaccine this year and then 5 years from now, you're going to have a problem. So that's an important thing to keep in mind with vaccine. Also, I'll take the opportunity that you're giving me with your question to tell you that in the country and other countries, there are a multitude of systems that are in place to monitor the safety of vaccines. We have always had systems in the United States that we have used, the Vaccine Adverse Event Reporting System, one of them. The Vaccine Safety Data Link is another one that we've used for many years. On top of this, when COVID-19 vaccines came out, the CDC created additional mechanism, the V-Safe system, in which people are asked after they receive the vaccine to please tell them any problem you have. So just to end, vaccines are studied extensively around the world. We look at data from all the world. The vaccines are safe. The vaccines are highly effective, and they have saved hundreds of thousands of lives, if not millions, around the world right now.
So true. Thank you, Doctor. Our next question comes from Scarlett, and Scarlett would like to know why isn't the percentage of people who are vaccinated and not vaccinated published? That is the percentage of people that are vaccinated and not vaccinated that end up in the hospital, so that everyone can clearly see there's no question that the vaccine is helping. So she'd like to know what those statistics or numbers are of people who are vaccinated or not vaccinated that end up in the hospital, so that everyone can clearly see how the vaccine is helping. Annette, would you like to take that?
Yes, that's a great question. You know, we are trying to do that. The health district, we gather all the information and we give the statistics to try to keep the community informed. But when we gather the statistics, we have to get it from various sources. But for these particular questions that you have, we're trying to get that information from the hospitals. So as you see a wave occurring, what happens is that the hospitals get really busy with all the other patients that they have. And then in addition to that, the COVID patients. And so it's a lot of times it's much harder to get that on a daily basis when we're going towards the peak, like this most recent peak with the Delta variant. It was actually very rapid. And so again, as the hospital staff get a lot busier, it's harder for us to grab that information. So what we didn't want to do was we didn't want to one day give you the information and then 2 days not give it to you, and then on the fourth day give it to you again, and not have that inconsistency. So now that the wave has slowed down, it's easier for us to get that information. We're doing our very best to gather that and to share that information, because we agree that is really important information for the community to have.
Thank you, Annette, and thank you for that clarity. Dr. Peterson, would you like to add to that?
Well, I would like to add to that. Although the health department may not have the day-to-day published in the newspapers in a graph, I would say it is available in the presentations that the city county has done with Dr. Bird. And those are available, I believe Annette can clarify, but still on the website. And there's some great slides there where it clearly shows the hospitalizations and deaths and those that have been vaccinated versus the unvaccinated. And it's clear as day the difference that it can make. And so that's available, if you go to the COVID City vaccination site, should be available there. I've used those slides in my own organization frequently.
Thank you, Doctor. Our next question comes to us from Helena, and she asks, I have asthma, need neck surgery and back surgery, and I only have one lung. If I take my first dose, will this endanger my health? My daughter has taken her first shot and has had side effects like not being able to taste. Does this occur to everyone? Dr. Ramirez, would you like to take that question?
Yeah, this is a great question, and I'm gonna split it in two. The first answer will be, since you are asthmatic and have one lung, I absolutely recommend you to get the vaccine. it'll reduce the risk for you to contract the infection. And also, since you only have one lung, your ability to recover will be less like a regular person who has both lungs. So I strongly recommend to use the immunization or vaccine. To answer the second question regarding your daughter who used the vaccine and developed loss of taste, even though the immunization can potentially create some URI type symptoms, sometimes, and it's not very rare to see, the patients who get immunized have been already infected with COVID a few days before. And when they receive the immunization, they already have been infected. And then they develop the symptoms later and they think it was the vaccine. So that could be the reason for why your daughter had that loss of taste. So that's my opinion on that statement.
Thank you for that explanation, Dr. Ramirez. That makes sense. I want to remind everyone, if you have an important question like Helena's question, press *3 on your phone now. You'll get into line, you'll talk to an operator, and we'll get your question read out so that the panel can answer it for you. The next question comes from Hardy. And Hardy asks, is it true that women in their 20s to 30s can be adversely affected by taking a vaccine in terms of their fertility? Is it true that women in their 20s and 30s can be adversely affected by taking a vaccine in terms of their fertility? Dr. Fergie, would you like to take that?
Thank you. It's an important, very important question, and obviously we take it very seriously, the issues of fertility, and I understand the concern. Absolutely no evidence of any problem with the vaccines and fertility. There's no issues at all that have been seen. I was mentioning a moment ago the fact that there are several mechanisms in the country to look at the safety of vaccine. There's one specifically also for I was thinking about pregnancy, but the V-safe mechanism, another mechanism. But there's no evidence at all of any issue with fertility. And I think Dr. Onufrak wants to say.
Go ahead, Dr. Onufrak.
Yes, I agree with Dr. Fergie. I also wanted to add that actually, if you are pregnant and if you're breastfeeding, it's actually recommended for you to get the COVID vaccine. So it doesn't affect your fertility. It does not cause miscarriages in any way. It actually will help protect you. COVID, if you're pregnant, then that is considered a high risk factor for being hospitalized and dying from COVID. So that's just, some misinformation that we're trying to fight. It does not affect your fertility at all. And we do recommend, if you are able, to get vaccinated.
Thank you, Doctor. Again, I'll remind our participants, if you have a question, press *3 on your phone now. Our next question comes to us from Roger, and Roger asks, can you explain the mechanism of action for each vaccine? How does the body create antibodies once the vaccines are introduced into the body? So can you explain the mechanism of action for each vaccine, and how does the body create antibodies once the vaccines are introduced into the body? Who would like to tackle that complex question? Dr. Onufrak, would you like to start?
So just basics. Your Pfizer and your Moderna are your messenger RNAs. That is, it does not affect your DNA or alter your DNA in any way. Messenger RNA is the blueprint. It tells your body to make the spike protein. And when your body recognizes that spike protein, your body makes antibodies to it. Now, what is considered your traditional vaccine is going to be the Johnson & Johnson, and that uses a viral vector. So it uses adenovirus, which is inactivated. None of these vaccines give you COVID in any way. So that viral vector will bring in the protein, your body recognizes the spike protein, and it'll make antibodies to it. Dr. Furry, do you want to add to that? That was just
Well, I thank you very much, Dr. Frank. That was that's good. I mean, this could take a long, a long time to explain in detail, but I think it's amazingly good that we have these new technologies. They're extremely safe. They have been studied obviously before the pandemic. These are not like they were created for the pandemic. These systems of administered vaccine were created way before the pandemic. And absolutely, I just want to emphasize what you're saying. This messenger RNA goes in to your body, goes into your cells. Give the cell the instruction as to how to produce just a little tiny part of the virus, and then your body develops the response to that, and it turned out to be a wonderful way to do this. And with the viral vector vaccine, is a somewhat similar mechanism, and your body develops then the antibodies against what they are producing. But great vaccines, new technology, well tested. Plenty of studies, and they don't alter as you mentioned, they do not alter anything inside you.
Thank you for that important message about it, because that is a common misconception. Our next question comes from Pragati. Are you aware of any data on people who got vaccinated having developed any new neurological issues? Are you aware of any data on people who got vaccinated having developed any new neurological issues? Who would like to tackle that question? Dr. Peterson, would you like to go first on that question?
Yeah, and I'll have Dr. Fergie chime in. I really wanted to talk about all the neurological issues that we're seeing in patients that are infected with COVID, because those are very significant. COVID in particular attacks the neurological system, and you've probably heard about a lot of people, upwards of 10% or more, have what's called brain fog, where they really have difficulty thinking afterwards. We've even had some children with paralysis, paralyzed from their waist down, or even what's called Guillain-Barré syndrome, which is another type of paralysis. And so, and we've seen increased rates of stroke in patients that have gotten COVID disease. And so I think, when we're talking about neurological effects, the first thing, one of the common symptoms that you're all aware of, hopefully, is your loss of taste and smell. Well, that's because it's attacking the neurological system that's happening, and, it's in the brain and all. So, I'll let Dr. Fergie try to tackle, because if there are complications from the vaccine, they must be exceedingly rare because they're not well published in the literature. So I'll let him tackle that part of it, even though we know neurological symptoms are pretty common when you get the disease.
Yes, I think that's exactly right, Dr. Peterson. I think that every time we talk about a particular side effect that people are concerned with the vaccine, it's really, that is what happened with the illness. That's what you're going to get if you get sick with it. Now, but I do understand where these concerns sometimes come from. And sometimes this is because, we have about 180 million people in the country vaccinated. Then anything that could happen, illness will continue to happen. But now it will happen in people who are vaccinated. And then there will always be individuals who say, well, this person, had a heart attack and he was vaccinated. Well, everybody now has been vaccinated, not everybody, but like a significant proportion of the population has received at least one dose of vaccine. So this is a problem we always have with all vaccines. And that is that as you vaccinate a large portion of the population, that doesn't eliminate neurological disease, cardiovascular disease, does not eliminate cancer, doesn't eliminate, car accidents. Things will continue to happen now on vaccinated people, but I'll reassure you, there have been nothing in particular concerning with a neurological problem following the vaccine, but there have been a lot following the infection.
Thank you, Doctor. Cynthia asks, when will the Johnson & Johnson booster shots be available in Corpus Christi? When will the Johnson & Johnson booster shots be available in Corpus Christi? Dr. Onufrak, would you like to take that?
So again, the CDC just recently recommended Johnson & Johnson boosters as well. And as soon as the CDC and DSHS guidance comes out, then we will be able to provide all Pfizer, Moderna, and Johnson & Johnson. Currently, only Pfizer booster is available at all of our vaccination sites. But again, like I said, once we get those recommendations, we'll put the press release out and it'll be available at all of our vaccine clinics.
Thank you, Doctor. Annette, would you like to also add to that?
I just wanted to add that at least 2 months after you had your one and done vaccine for your booster, and we're hoping that this will be any day now, maybe even as soon as tomorrow. And like Dr. Onefrak said, as soon as we get that green light, you know, the mall, La Pomera Mall, we also have the outlet mall in Robstown at the old Nike store. We have the Greenwood Senior Center right behind the health district. And so we have various locations that you'll be able to get that booster. Very exciting.
Thank you, Annette. Renee asks, why aren't you advocating for early treatment when diagnosed with COVID? Why aren't you advocating for early treatment when diagnosed with COVID? Luis, would you like to take that? Or sorry, Dr. Onefrak, would you like to take that?
So at the health district, we've worked with our emergency room physicians, with our PCPs to tell them about the infusion clinics. So that was that is what we were advocating, because you need to get treated within the first 10 days. So Driscoll Hospital, we had the infusion clinic that were originally in the green tents. They're still going on at Robstown. All of our healthcare providers know about the Regeneron clinic. So it is, if you have COVID, then that is something that you can discuss with your physician.
Thank you, Doctor. Our next question is from Alice. And Alice asked for some clarification about the booster. She is hearing that, or they are saying that 65 plus or comorbidity. Can you just be 65 and get the booster, or do you need to have other issues to get the booster? The language for Alice is a bit confusing. Dr. Ajalade, would you like to take that?
Yes. So yes, you can be just 65 and get the booster. You do not need a comorbidity in order to get the booster if you're 65 or over.
Thank you, Doctor. Our next question comes to us from Robert. And Robert asks, my daughter-in-law is pregnant and her doctor doesn't recommend that she takes the vaccine. Is that normal for pregnant, and is it recommended? So he has a daughter-in-law who's pregnant, and her doctor doesn't recommend that she take the vaccine. And he'd like to know, is that normal for pregnant women, and is it recommended? We'll go to Dr. Peterson first, and then Dr. Fergie, and then Dr. Onefrak.
Well, I think you saw that all of us raised our hands at the same time, because the information is really quite clear on this one. So it's a pretty easy question to answer, that all the professional societies and, you know, some great studies that are out there definitely recommend that pregnant women get the vaccine. So I would question that advice, because the OBGYN Professional Society definitely recommends that, as well as the CDC and many other professional organizations. And let me just say that, unfortunately, we have seen a lot of pregnant women, and this has been mentioned before, but you know, when you're pregnant, your immune system is a little bit suppressed, and you can have a much worse case of COVID. And very tragically, we have seen pregnant women who have died of COVID, either while they're pregnant or they're having to take the baby, and then shortly after they deliver the baby, the mother has died. We've had that situation, babies transferred to us, and unfortunately that child no longer has a mother. And so, you know, not only is the mother protecting herself, she's protecting her baby as well. We know that the antibodies will protect that baby in the first few months of life, just like we recommend pregnant women get a flu shot and the Tdap vaccine in their third trimester. That's really to protect the baby in those cases, but to get the COVID vaccine is going to protect that mom especially, but also her baby. And I'm sure the other physicians can chime in as well, but really strongly recommended at this point.
Thank you, Dr. Peterson. I think actually your answer was so complete that they put their hands down. So thank you so much for that complete response to that question. Then our next question comes from Kathy. I'm considering moving in with my grandchildren. How safe are the schools in North Padre Island? Do the children have to wear masks? Do they have to get shots? What are the safety guidelines? Dr. Anya Frank, would you like to take that?
Yes, I can take that question. I live on North Padre Island. My son does go to Seashore Charter Schools. Currently, they do not require masking or vaccination. They do recommend masking and vaccinations, but it's not a mandate at the school. It's a smaller school, so the cases are not that high, but it's not what I would have wanted. Last year we did have a mask mandate. This year it's not required. They are following TEA guidelines though.
Okay. And Dr. Fergie, would you like to add to that?
Yes, Kathy, what I want to tell you is that, first of all, if you're concerned, the first thing, I assume you have received your vaccines already. Because that's the most important thing. Second is you're moving into a house with your relative, I imagine, your son or daughter, then be sure they are vaccinated too. And then on top of that, the children, if they are in the age and they can be vaccinated, they should also be vaccinated. So my concern would really be that, not really as much as the school, it will be the issue of the household where you're going to be living. And please be sure you are vaccinated, everybody there is vaccinated, and you'll be safe.
Thank you for that answer. Thank you, doctors, for your answers. Our next question, are vaccinated individuals able to catch and transmit COVID the same as an unvaccinated person? So are vaccinated individuals able to catch and transmit COVID the same as an unvaccinated person? Annette, would you like to start with that one? Oh, I think you're on mute, Annette.
I'll go ahead and defer to Dr. Fergie.
Okay, Dr. Fergie.
Thank you. So again, it's a very important question, but also if you are vaccinated, your chances of contracting the COVID is much, much less. It's not zero, but it's a lot less, 95% less or so, maybe with the Delta variant, maybe 90%, but again, much less. Okay, so let's say you, bad luck, you do get it, and some people do, and we know that, we have seen it, the breakthrough. So then I would say, yes, that you can transmit it, but what we know is that you will transmit it for a much shorter period of time than somebody who is not vaccinated. So clearly the vaccine will prevent most of the infections. And if bad luck, you're one of those individuals who has what we call a breakthrough infection, you can transmit it, but less, shorter period of time.
Denzel, would you like to add to that?
I just wanted to add to Dr. Fergie's statement in regards to herd immunity. So really, the whole purpose of people getting vaccinated is not only to prevent, decrease the amount of hospitalizations we're getting, prevent people from getting severe illness, but it's also to increase that herd immunity that we're seeing in our community, to prevent the virus from jumping from person to person. So I just want to add that.
Thank you, Denzel. Our next question is from Nathan, and Nathan has a two-part question. So he'd like to start with the first part. Firstly, once you have gotten the vaccine and the follow-up booster shot, you were to still get COVID, what would that look like? So Nathan would like the response to that before he asks his second question. So the question is, once you've gotten the vaccine and the follow-up booster shot, if you were to still get COVID, what would that look like? Dr. Onufrak?
So the majority of the patients that came into the Regeneron clinic, we were seeing upwards of 150 COVID patients a day and treating them for COVID. The majority of them were unvaccinated. The very few that came in that had the vaccine breakthrough had very mild symptoms. You could hardly tell that they were sick. They might have complained of nasal congestion, maybe a mild headache, but the ones that were unvaccinated had very severe symptoms. And some of those we actually, they were too sick for us to treat outpatient, and we had to send them to the emergency room. But if you're vaccinated, that's the goal of vaccine. Unfortunately, it's not 100%, but it does prevent 95% of hospitalizations and death, and that's the goal of getting vaccinated. You can get it again, but it does prevent 95% of hospitalizations and death.
Thank you, Doctor. Annette, would you like to add to that?
Well, yes, but I was also going to mention that because I know they asked about the booster. I don't believe that any of the patients that came in for the Regeneron had received their booster. Now they were, some, like Dr. Onufrak said, were fully vaccinated. They had their 2, but none that I know of had a booster as well, came in to get treatment.
Thank you, Annette. Unfortunately, we've come almost to the end of our event, and that was the last question for the night. We've had so many great questions this evening, and so many great answers, of course. Annette, Director Rodriguez, Annette, having covered so many aspects of COVID-19 vaccines, and based on what you've heard tonight, what action would you like to see from the participants who took the time to listen in to tonight's telephone town hall?
Well, and Barry, I see one more question, and I think it's a really great question. So I kind of want to end with this. It says, we see reports that case numbers are declining locally and nationally, but we also see warnings that people should not go out because of the danger level that is too high. How should we interpret these mixed messages? And when do we know that it's okay to open up a bit more? That's a great question. There is a lot of communication or over communication in some respects. And so you're really having to pay attention to these numbers because we are declining. Our numbers are declining right now. We're very clearly going down, this third peak. We are anticipating another peak, though, probably mid-January, maybe early February. So you're really just going to constantly have to be in tune with what is being put out in the media and trying to pay attention to where you're at, the community, the environment that you're at, and the numbers that we're giving you for here locally. But I want to end by thanking everybody for being on this virtual town hall meeting. And to, one of the questions said, you're pushing vaccines on us. And I don't like to see the word pushing because in public health, we like to educate. And so I hope that you don't ever feel that anybody's pushing you into doing something. We're adults, you make that decision on your own, but we want to give you the best information that we have. And then you can make that decision based on that information. And so I'd like to end this by saying thank you to everybody. And if you were on the fence for getting the vaccine or not, I hope that maybe some of the questions were answered for you and that maybe you will decide that the vaccine will help you. And we know that it does save lives. So thank you.
Thank you, Annette. And unfortunately, we have run out of time. And thank you so much for getting that last important question in there. I'd like to say thank you to our wonderful panel of public health and medical professionals, and importantly to all of you across Corpus Christi and Nueces County for taking the time to join the conversation and ask your important questions. If we were not able to get to your question tonight, or you have an additional comment that you'd like to make, please remain on the phone and you'll be prompted to leave the panel a voicemail. Thank you and have a great evening.